Welcome back, everybody. So today we're going to have a look at the kinds of restorations we use in the practice. Specifically in this video, we're going to talk about composite resins, which is what I've got out in front of us today. So let's have a wee bit of a look. Okay, so the first thing to know about a composite resin is that we're referring to a white filling. White fillings come in many different shades. We have commonly used in this practice are A1, A2, which is what I've got out here, and A3. There are a couple of different types of composite resins, predominantly that we use in this practice and throughout dentistry. The composite resin in the tube here, and also the composite resin in the gun or click applicator. So those ones are in a little capsule just in here. This is the actual composite part of that. All right, so the first thing to know when doing a composite resin, you start with etch, which is our little blue one here. This works as like a little shampoo for the tooth. So this cleans and washes the tooth in preparation for the bond. This is the bond here. It's a light curable bond. So we apply that using a micro brush as seen here, and we pass that over to the dentist. Sometimes with the bond, you can put it into a Dappins dish, which is a little dish like this. I will show you. You can use something like that to put the bond in, or alternatively, you can put the bond directly onto the micro brush and dispense it to your dentist, who will then apply it to the area. As I said, it's a light curable bond, so we use our light cure, which is this guy here. These guys come in all different looks, brands, you name it. So we just click that guy on, we do a 20-second cure, then we get preparation for our resin. So the dentist will tell you, is it an injectable resin or is it a body resin, which is the one in the tube. All we do is take the cap off. This is light curable again, so you need to be careful of having it exposed to the light. We take a little part off onto the slab. We cut it using our spatula just here. So we pop it onto the slab, distribute the slab to the dentist. In order to place the filling, the dentist needs to use a couple of instruments that we have here. So we have got a flat plastic and a ball burnisher. So depending on the size of filling may depend on the size of ball burnisher that you use, but that's what we've got out today. Moving over to our injectable resin, it's exactly the same. It's etch bond composite. It's etch bond composite. So we pop our composite resin gun over to the dentist, taking off this little cap here. We take that off and pass it over to our dentist, and then they place that filling. Again, light curable composite requires a light cure. Again, you cure that, and the same with this one here. You cure that for your 20 seconds. Sometimes if it's surrounded by a band, we take that off and also do a double cure. Once the filling has been placed, the dentist will polish it using their slow and high-speed hand pieces. In order to check that the filling is fitting properly in the mouth, we always have out some bite paper or articulation paper. This comes in blue or red. Our dentist prefers to use red. You say to the patient, just gently come together, gentle tap, tap, bite and grind side to side, and this will show up any high spots on the filling. Sometimes they fit perfect, otherwise the dentist will just adjust as necessary. But that is the steps to a composite filling. Now for our benefit as well, I have our gauze out. As I explained in another video, I always have two pieces, one for the dentist to wipe off his instruments and one for us for patient care. But in this instance, you may use it for wiping the instruments that the dentist is using, as he or she will pass them back to you as he's placing the filling. I always have out a pair of cotton rolls for the dentist. He may put those in the patient mouth to help retain, absorb moisture, but also gives us a little bit of area to lean around in. I also like to have some cotton pellets out as well. This helps with the dentist applying the composites and polishing. So that's our composite setup. So remember, etch bond composite. That's your composite filling go-to. Doesn't matter if it's a tube or an injectable, it's always etch, bond, composite. Okay, so I hope that was really helpful. I will see you next time. But otherwise, happy nursing, happy assisting, and have a great day. Bye.